Hi, this is Riley from the Thunder Bay Chamber of Commerce, and I'm very excited to be here today with Juanita Lawson from the NorWest Community Health Centers. Juanita is the CEO there. Thank you so much for joining us today, Juanita. We're here to talk about the fact that the Chamber's fundraising group, 100 People Who Care, was able to raise $3,100 this quarter, and our group voted to donate the proceeds to the street outreach program with the NorWest Community Health Centers. Juanita's here to tell us a little bit about it and to tell us a little bit more about what NorWest Community Health Centers is doing these days. So Juanita, we were able to raise $3,100 for the street outreach program. Would you like to tell us a little bit about it?
Yeah, absolutely. And we wanted to initially start off with thanking the 100 People Who Care because the services and the resources that they're going to be offering and are making available to NorWest and the clients we serve is very much appreciated, especially given where these funds are going to. So we wanted to start off by thanking them for sure. So the funds, in terms of what we've been funded to do, is to really look at this donation will help our outreach team really provide the resources at a street level to individuals who are facing multiple barriers to care, and specifically accessing resources, and especially for those who have, through the pandemic, really been experiencing a lot of difficulties with not only accessing their social support network or individuals who they might have already been engaged with healthcare resources. But they're also, individuals are also facing a number of barriers just because things that we take for granted, such as access to Wi-Fi or having access to technology or even having a bank card to pay for food, where individuals who are vulnerably housed or are living on the street don't have access to those things. And we found that through our outreach, those are some of the struggles that they were really experiencing. So with this funds, we were able to, and especially with the heat, and last week we all enjoyed the Thunder Bay weather and having the heat, but it also for individuals who don't have housing, the heat alert and not having access to hydration or to shelter or those type of things is quite concerning. So one of the great things that we were able to do is not only through our harm reduction and our peer workers who were going out, they were able to identify that a number of individuals were also not accessing healthcare. And so we were able to increase the resources that were going out on the outreach by providing a nurse. And through that nurse, we were able to provide just access to some health services such as like minor ailments and wounds and doing some assessments so that those individuals, their healthcare needs would not be more problematic. So they're able to address that on the street. And the other thing is, one of the things that we saw is, so we're not only able to access and increase our healthcare services, but also re-engage some of those individuals that we had lost touch with. We as well went to a virtual model, which meant that, again, individuals couldn't just walk into our building. And so we were able to reestablish care, but also simply provide things like we were able to provide services such as clean food, clean underwear and socks. Laundromats were closed. They didn't take, again, the issue of finances. So those really basic things, trying to meet their basic needs, were some of the opportunities that we were able to provide with regards to the donation.
That's amazing. I don't actually know how to respond. You're doing a lot. So,
and I think, the other thing that we're thinking about is, and I don't want to, we're loving summer, but the reality is the cold is going to come. So part of this donation as well was stocking up on things like hats and mitts and those things, again, that we know people who are very vulnerably housed and are living on the street, that they will be provided with those resources when the time arises. And the other thing is we did a lot of outreach to individuals that we know and have been connected through that are at risk. So again, those who might be using substances alone, or potentially unsupervised. And so again, bringing them into hopefully our Path 525 service. So yeah, so those are some of the things that were the opportunities that we were able to do with these funds.
That's amazing, Juanita, and I'm so glad that we were able to help with this. It seems like a really valuable service for the community.
Yes, yeah, and I know we had mentioned before, just that this is, I mean, there's always a need in our community, and many organizations have really rallied around and tried to look at how we offer services in a different way. And we are doing that now, also taking a look at what does the future hold for us in our community, and what does the future hold if this pandemic continues. How are we going to continue to operate in a different way? And I think we are looking at the future of our peer support worker. We have a program in place until the end of March, but we are looking at how do we increase our peer support workers who have the knowledge and the skill to really engage with those individuals who, might not want to engage with the nurse right away, right? Until they build that rapport. So we're looking at building a peer mentoring program and looking at some honorariums that we might be able to provide those peers because they do such valuable work.
That's amazing. You had mentioned when we spoke earlier that you had some positive stories that you could tell us about the way things are working.
Mm-hmm. Yeah, we had a number of clients who we our staff did home visits to, and for example, we're seeing individuals who didn't know about resources that they could apply for, and they were engaging with grandparents who had 4 grandkids with them, and they had their own health conditions and were really concerned about going out. So they did of health teaching, but we're able also to say these are some of the services that you can access, but also engage some of the services at NorWest and other organizations in the community that we're doing with, like emergency food boxes and food hampers and those type of things. And they also did, so that really helped in terms of just tapping into those individuals and making sure that they have what they need, even if it was for a week. To try and provide some of those other resources.
And be a bridge between them and the resources that they might not yet know about. That's super valuable.
Exactly. Yeah. And there was a lot of concerns, rightly so, right, about COVID. And also, I think just reaching out to those individuals who really maybe didn't have access to all of the knowledge that they needed. So talking about cloth masks and handing out supplies to wash their hands and those type of things. So it was a great, lots of creativity and really doing our work in a different way, which many people in this community have done. So but we're really thankful for some of our staff that have got some of those, the capacity and the initiative to do that.
Well, I think it's pretty amazing that you have the capacity and the initiative to do what you've been doing. Thank you so much from all of us in the group and from the community at large.
Thank you very much.
Is there anything else you want us to talk about before we head off?
No, I mean, I'm just really thankful for people that, the 100 people who care, that it's just, it's very heartwarming. So I have to say that it's just a really neat initiative, and I'm going to sort of tell some of my staff that and myself involved as well that we need to get involved in this as well, because we're very blessed, right, in terms of our we have lots of privilege.
We'd love to have you join us. Where can people find more information about the NorWest Community Health Centers and the work that you're doing?
Yeah, so we have the NorWest Community Health Centers. We have a website, and at any point, people actually can simply call the center as well and talk to a community health worker, and they can get lots of information as well about all the programs and services through our website.
Lovely. We'll pop that address up there at the bottom of the screen for people. And I also want to let folks know, if you're interested in joining the 100 People Who Care, we meet once a quarter. We each chip in $100. With their $100, you get the right to nominate a charity to receive the entire pool of funding and the right to vote for the winning charity at the end. Visit our website at tbchamber.ca/100people for information on that. Juanita, thank you again. Folks, if you're just joining us now, you're meeting Juanita Lawson, the CEO with the NorWest Community Health Center. She's been here talking with us about their amazing street outreach program. Thank you again, Juanita, for joining us.
Thank you.
Have a great day.
You too.